Osteoarthritis, or OA, is a common disorder that affects the joints and is caused by a loss of cartilage. Cartilage is the smooth white tissue that covers the ends of the bones where they come together to form joints. When this cartilage surface is lost or destroyed, the underlying bone becomes exposed. As osteoarthritis progresses, more cartilage is lost and eventually the bone rubs against the bone within the joint. Osteoarthritis affects over 27 million individuals in the United States alone. It is generally progressive and often results in pain, deformity, and stiffness, as well as a reduced quality of life and activity levels. The cause of osteoarthritis is unclear, but it does involve a complex biochemical reaction. Some factors are known to contribute to its development. The global rise in obesity is connected to a significant rise in the frequency of arthritis, particularly in the knee joint. Genetic predisposition, or the likelihood of developing a disease based on your genes, has been connected to osteoarthritis, especially in the joints of the hand and wrist. Trauma and injury can also contribute to the development of osteoarthritis. Joint instability and poor alignment of bones due to muscle and ligament weakness can also lead to cartilage loss and osteoarthritis. Increasing age has been associated with osteoarthritis. However, it does not occur in all people, and the disease should not be considered inevitable. If you have osteoarthritis, you will generally experience joint pain related to activity. As the condition progresses, you may feel pain while you're at rest or even asleep. Additional symptoms often include joint stiffness and deformity, which can limit your overall function and quality of life. In some individuals, osteoarthritis progresses slowly and can be managed for years without surgery. In other individuals, osteoarthritis can progress more rapidly and cause severe pain, sometimes prompting the need for surgery when other treatments have failed. At this time, there is no ability to reverse osteoarthritis, only treatment for the symptoms you're experiencing, which can provide significant pain relief and improvement in your function. If you have questions about your osteoarthritis, your symptoms, or your treatment plan, please contact your healthcare team. Be healthy.